Hello, I'm Addison Chandler, and I'm presenting my PowerPoint of Psychology in My Life, which will be explaining and analyzing what I learned in this course and how I can implement it into my future career. In order to compact a whole lot of knowledge, it is important to set a basis and good understanding of the concepts and vocabulary that will be used repeatedly. Firstly, psychotherapy is the treatment of mental disorders by psychological rather than medical means. Sexual violence is any sexual act or attempt to obtain any sexual act by violence or coercion, an act to traffic a person, or an act directed against a person's sexuality regardless of relation to the victim. Treatment is defined as the administration of appropriate measures that are designed to relieve a pathological condition. Sexual trauma is a sexual situation that causes intense fear because the subject is exposed to it in a state of passivity and unpreparedness. Emotion is defined as complex experience of consciousness, bodily sensation, and behavior that reflects the personal significance of a thing, an event, or a state of affairs. And aggression is any behavior that is intended to harm another individual. Currently, I am planning and working towards becoming a nurse with the hopes to complete the SANE nursing certification. The acronym SANE stands for Sexual Assault Nurse Examiner. Nurses with this certification and program treat victims of sexual assault, abuse, and rape, and are the first people to help patients and not only oversee their care, but also guide legal matter, conduct reports, and work with police investigators and other legal authority, all while making sure the patient's health and well-being is the primary concern. Essentially, these nurses are advocates for the patients on all grounds. And so in order to have a better understanding of my patients, what they've been through, how to treat them, and how to react, I need to know the psychology behind the patient's treatment and response so I can perform the best care I possibly can. And this course has allowed me to do and learn just that. As previously stated, I took this course to better understand my patients, what they've been through, and how to treat them, how I should react. This course taught me about substance abuse and usage, psychological disorders, stereotypes, identity, emotion, and aggression, all of which will help me gain understanding of my patients when they come in, whether they're drug users going through withdrawal or on the autism spectrum, and therefore allow me to treat them correctly. Because knowing the patient, their history, symptoms, illness, conditions, etc., determines how I respond and treat and guides me on what research will need to be conducted. In Chapter 4 of the textbook, I learned about substance use and abuse, as well as the effects of each. I explored many topics and terms such as withdrawal, stimulants, physical dependence and psychological dependence, opioids, methamphetamine, methadone, clinics, hallucinogens, depressants, codeine, and much more. Having knowledge of substances in each of them is important not just for me and my career, but for any public health occupation, or really any public occupation. This is because it is likely many patients will come in and be involved with some sort of substance, whether over the counter or not. And so understanding each of these and having the ability to identify what is being used and if the patient is going through withdrawal or their symptoms are caused by a reaction to said substance will not only benefit my career, but be fairly crucial to it. And so the study of these allows me to treat my patients effectively if they're using a substance and are symptomatic of negative effects of one. To understand patients' health and their best course of treatment, it is extremely important to understand all psychological disorders in order to be able to treat them and to respond to them correctly. Of course, if a patient came in already affected by trauma, they would not be in a good or stable mental state. And so, as all patients I will receive would have been through a trauma, if a patient has a mental disorder, it will be especially likely they will be disoriented, panicked, and or aggressive. And so on these cases, treatment and response could be different than others. For example, someone who has autism or schizophrenia might respond to aid with aggression, yelling, not keeping still, or basically allowing physical contact. And in general, being very emotionally distressed. So knowing details of different psychological disorders such as attention deficit disorder, autism spectrum disorder, bipolar disorder, or PTSD, and being able to identify them on the spot would benefit me in my ability to care and assess distressed patients, as well as protect them from injuring themselves, others, and myself. In addition to other disorders, knowing the ins and outs of post-traumatic stress disorder will be important not only to better understand the patients, but to be able to identify the development of it and help treat patients early on and even prevent it from occurring or progressing. Post-traumatic stress disorder is a condition that one has in relation to a traumatic event that had or does occur in one's life. And so the study of this is relevant to my field, as many victims of sexual violence develop this disorder after the event. And the first emergent and immediate treatment and examination can make a large impact on the patient and their likelihood to develop this condition if I do not respond or treat them correctly and cautiously. And so knowing the details of this disorder and how to treat it is crucial for the health of my patients throughout examination, treatment, and legal proceedings. I think my biggest takeaway from this course will be the study of Chapter 16 in the textbook, which is primarily focused on treatment, and this is because of its relevance to health-related careers. I learned about different kinds of therapy and what the techniques have been used in the past and proven faulty. Some of the more important concepts were biomedical therapy, which is treatment that involves medication and/or medical procedures, cognitive therapy, which is a form of psychotherapy focused on a person's thoughts, cognitive behavioral therapy, which is another form of psychotherapy that aims to change cognitive distortions and self-defeating behaviors, as well as comorbid disorder, involuntary treatment, relapse, and involuntary treatment. I found that trauma-focused cognitive behavioral therapy was a primary treatment for victims of sexual violence. And so having studied both cognitive therapy, behavioral therapy, and cognitive behavioral therapy, and the topic of psychotherapy as a whole, I am better prepared to administer care for the aftermath of traumatic incidents in my patients and what they will have faced. In this course and in this research project, I found studies on different therapy treatments for survivors, all of which will help me apply concepts from them into the treatment of my patients. Sexual assault and abuse can inflict severe physical and emotional trauma to a victim, and an Innovations in Clinical Neuroscience article titled Psychotherapy with Sexual Abuse and Assault evaluated the use of psychotherapy for victims and further implemented and explored treatment for victims. The CDC estimates that 1 in 3 women and 1 in 4 men face sexual violence at least once in their life. And this article acknowledges this data and evaluates studies and experiments with a focus on these victims and the results of each. Psychodynamic psychotherapy was shown to be effective in treating patients with PTSD that might have resulted from sexual assault, as well as trauma-focused cognitive behavioral therapy and eye movement desensitization and reprocessing. What I have learned from this study will allow me to implement aspects of the treatments into my patients' care, both immediate and emergent, and as well as throughout legal proceedings. And though I will not be providing a licensed therapy treatment, I can use approaches in this journal article to comfort the patient and reassure that no further discomfort will be brought upon the patient. Essentially, this will benefit my approach to discussing and treating the patient and making medical care easier and more comforting for the patient, as these patients have been violated and are usually very opposed to physical touch and treatment. Psychodynamic psychotherapy was a course of treatment also mentioned in this article. It was primarily used for victims of PTSD. Some distinctions of the treatment are a focus on effects and expression of emotions, exploration of attempts to avoid negative aspects of experience, identification of recurring themes and patterns, discussions of past experience, focus on interpersonal relationship, and focus on therapeutic relationship, and even exploration of dreams, wishes, and fantasies. In addition, I found relevance in the focus on emotions and acknowledgement and attending to the patient's discomfort. Due to the possibility of the patient feeling unsafe and even re-traumatized without these elements, I intend to implement them as a focus when I'm treating patients. And even while I do have to focus on logistics and medical care, trying to make the patient feel comforted and that their feelings are also important will make a large difference. It will both benefit the patient, but also prevent from re-traumatizing them or worsening their feelings of violation. This journal also involved the study of trauma-focused cognitive behavioral therapy, which is a brief resilience-building model for trauma-impacted children or adolescents, as well as their parents and caregivers. Its main components were separated into phases. Phase 1 consists of psychoeducation about trauma impact, parenting skills, relaxation skills to reverse physiological trauma response, effective skills to address emotional dysregulation, and cognitive processing skills to to understand the cognitive model. Phase 2 was solely trauma narration and processing, and Phase 3 was in vivo mastery to address overgeneralized fear and avoidance, conjoint child-parent sessions to enhance communication, and focus on enhancing safety. Though these are all complicated, example cases were given to help my understanding. And I believe it also made it more identifiable for me who the treatment would apply to, how, and quicker. And while I could not perform a multi-step therapy session for my patient, understanding the focuses from this can allow me to apply them to my patients in the short term. For example, this case they used was an 11-year-old boy who had been sexually abused by his uncle. His responses were documented and he showed the sullen effect and was very withdrawn. Knowing this and how it was treated, if I have a child come in to examine and they are withdrawn and sullen and or simply non-communicative, I could respond with phrases and concepts that therapists use, which were documented in the article, and even use relaxation skills as well as allow trauma narration and processing if the case isn't emergent. The last treatment was eye movement desensitization and reprocessing, which is a form of psychotherapy performed to alleviate the stress associated with traumatic memories. In a very interesting way, the therapist uses rhythmic techniques for the patient to redirect their focus while having the patient discuss their trauma and trying to bring in more positive thoughts simultaneously. In this treatment, each phase is one step. First, they discuss the patient's history with identification of targets and traumatic events and experiences, then preparation, assessment and developing a goal, desensitization and reprocessing a memory until the stress is decreased, installation of positive cognition associated with a disturbing event, a body scan assessing distress, debriefing closure, and reevaluation of ongoing symptoms. While the treatment itself would not be a viable option for me, as that is not within my job description or ability, I believe there would be benefit to having a patient have something rhythmic to focus on. You see parents snapping their fingers or waving their hands, hanging a toy to get kids to focus for pictures. And you see doctors having women in labor focus on breathing, and a doctor in really anything other than the pain. And so following certain aspects and techniques from this treatment to redirect the focus of some of my patients may help alleviate feelings of distress and confusion for overall better ability to perform patient care. And to conclude, really one of the most important concepts to apply to any and every career is proper research. To be a good doctor, scientist, etc., you must know how to not just conduct research, but analyze research and know how to apply it to your own field. Knowing the different types of research, archival and cross-sectional, knowing the difference between an experimental group and a control group, and knowing the importance of deductive reasoning, and generally knowing how to determine what is fact or false are crucial. Even today, I use my knowledge of peer-reviewed journal articles from Chapter 2 to make this presentation and study topics and concepts of psychology. It will aid me in my career and study and my specific job. One of the most important findings to understand and treat a patient is analysis of research. Having cross-section and archival research available, as well as meta-analysis, which is an important research process that combines and studies for an absolute effect, is an advantage and not one to be disregarded. Knowing how to check and apply validity and acknowledging observer bias will greatly affect my ability to provide patient care. And without this ability, many cases could become life or death. And in the future, having studied the science behind research and how to apply it to psychology will make a large impact on both my academics and my career.